A new twist, meantime, on medical tourism. American hospital care has become so expensive, some employers are paying patients sometimes up to $5,000 to receive care in other countries. And here's the new twist. They're sending an American doctor with them to perform the surgery. This all from a report in the New York Times. One particular company, Ashley Furniture Industries, revealing the practice has saved them $3.2 million in healthcare costs since 2016. Dr. Kevin Campbell joins us. Dr. Campbell's a cardiologist. And as I said, it's not new, right, Dr. Campbell, for someone to engage in so-called medical tourism, to go somewhere else to have a surgery out of the country. But bringing your own doctor, I guess, is something of a new twist. What do you think of it? You recommend that or what?
Medical tourism is something that, really was born of the broken healthcare system in the United States today. A lot of patients are going overseas to get things done at a much lower cost. This is a new twist, bringing your own doctor. I think you still, while you have the quality surgeon that you want, that you've chosen from America, you still have to worry about the conditions in the operating room. What are the sterility conditions like? What is the post-op care going to be like? So I do think patients are taking on significant risks when they go to these other countries.
Right, makes sense that some risks would still remain. Obvious advantage, and we're flashing this on the screen now, is cost, comparing what happens in the U.S. and what happens in a particular hospital in Mexico. Cost of medical device used in a knee replacement surgery happens to be on the screen now. $8 grand here, $3,500 there, and some of the other costs were just as drastic. So that's the issue, right? So something you would think, we've said this for years, should be done about that. What's the biggest single factor that plays into those disparities?
I think it's the fact that our hospital systems are overloaded with administrators, and these administrators are very expensive. There's data out there that shows the rise of hospital administrators is about 3,200%, whereas the number of doctors produced every year remains pretty constant. So this is undue cost. And yes, manufacturers charge us far more for devices here in the U.S. than they do elsewhere. And part of that is because when they sell that device to a hospital, the hospital marks it up 3 to 4 times, like a bottle of wine at a nice restaurant, right, when they sell it to the patient.
Now, if someone's going to deal with that, and many of these people have, by, again, engaging in so-called medical tourism and going to another country to have a procedure done, I would think, just by, and this is not based on data, but just based on what I think is common sense, it would depend on what the procedure is, right? I mean, you're a cardiologist, so somebody having a heart procedure is far different, right, than some sort of knee surgery or,
I certainly think the acuity and the difficulty of the procedure should play a role. They're saying that you choose your surgeon from the U.S. and bring that person over, but there are a whole lot of factors in the operating room. Who assists you? What how clean the operating room? How good the equipment and reliable the tools are? There's so many factors that are difficult to control. The bottom line is we need to do a better job of making healthcare more affordable in the United States.
Right, but your larger point, it's a good point, is that if you were performing a surgery, God forbid something went wrong, it might not be because of what something you're doing, but something, the conditions, or something that's uncontrollable, which people should think about. So.
Absolutely. You cannot control for these conditions in any environment. We are so highly trained in the United States. I know my team, and I know my nurses, and I know my technicians. Over there, you have no idea what you're walking into.
All right. Interesting story, nonetheless. Kevin Campbell, Dr. Campbell, thanks for coming on. We appreciate it.
Seems so crazy.